Today, our topic of discussion is on nerve muscle physiology. Let us understand what is nerve muscle physiology. Nerve muscle physiology. Nerve muscle physiology. First, let us understand what is nerve. Nerve is a bundle of neurons which is controlling the activity of the muscles. If we talk about motor nerve, it is that nerve which is carrying information from center to the periphery. Here I have drawn the diagram of motor nerve, and which is actually controlling the muscle fibers. Muscle fibers, it may be cardiac muscle, it may be smooth muscle, it may be skeletal muscle. It is multi-nucleated, cylindrical and elongated structures. If we talk about the combination between nerve and muscle, any type of muscle, maybe it is cardiac muscle, maybe it is smooth muscle, or maybe it is skeletal muscle. Muscle is controlled by the activity of the neuron. Again, if we elaborate it, say it is the neuron, we will have cell bodies, dendron, dendrites, and this is the most valuable structure here called axonal block. It is the place where axon potential is generated. We will slowly elaborate the axon potential, how it is generated, and then how it is traveled. And then ultimately, this axon potential will act such a way so that there will be a release of neurotransmitter, say acetylcholine or glutamate or GABA. Few of neurotransmitters are inhibitory, few of neurotransmitters are stimulatory. Ultimately, what will happen? There may be a contraction. If it is stimulatory, there will be a contraction. If it is inhibitory, then there will not be any contraction. So what will happen? If we expect any type of action or any type of work, then we have to either stimulate neuron or directly we can stimulate muscle also. We'll have to stimulate. We'll have to provide threshold stimulus. Then only we will have a result. Maybe excitatory result or maybe inhibitory result. Now coming to the types of muscles, if we talk about, muscles can be divided on the basis of their striations. On the basis of their striation, cross striation, it is striated muscles and non-striated muscles. Correct? Non-striated muscles. According to their action, it is voluntary, and involuntary. Means voluntary means we can regulate the activity of the muscle according to our will, that is voluntary, and involuntary we do not have any will. Correct? Automatically the muscle will be controlled. Another is the muscle is structurally it is three types. One is skeletal muscle, another is cardiac muscle, and another is motor. Now, actually, if we look at Again the meaning of non-muscle physiology. Our aim is how the neuron is controlling the activity of the muscles. Maybe cardiac muscle, maybe skeletal muscle, or maybe smooth muscle. Now coming to the resting membrane potential. Today we will be talking about resting membrane potential, resting membrane potential, gradient potential, and action potential. Resting membrane potential, briefly it is called RMP. What is resting membrane potential? It is the potential difference across the cell membrane at resting distance. It is that potential, resting membrane potential. It is the potential across the cell membrane, across the cell membrane at rest. Generally, if this becomes minus 70 degree, most of the textbook you will find this value. Some of the textbook they have mentioned minus 70 millivolt to minus 90. Now coming to the cell, we are talking about the resting membrane potential is minus 70 millivolt. How minus 70 millivolt is generated? What is the mechanism behind this generation of minus 70 millivolt? So behind this, if we talk about the generation of or maintenance of minus 70 millivolt, then we will have to talk about three channels, three different type of channels. One is sodium potassium ATPase, where 3 sodium ions are going out and 2 potassium ions coming in. Sodium potassium ATPase. Try to understand. If you have any question, you can ask. So ultimately, what will happen? 3 sodium ions going out and 2 potassium ions coming in. Due to this, we may see the alteration of volt, that is from 0 millivolt to minus 5 volt. Only this much effect we will have if only sodium potassium ATPase works. But our aim is to talk about how the minus 70 millivolt comes out, how it is generated. So here, because of this, 3 sodium ion going out and 2 potassium ion coming in, means negativity is maintained, and that is only if we talk about starting voltage 0 millivolt up to minus 5 millivolt. This much changes we can see. Then next is, if we talk about another channel, that is potassium channel, leaky potassium channel. See here it is leaky potassium channel. This is the second channel we are talking about, that is leaky potassium channel. The function of this channel is to move potassium ions from inside towards outside. Why? If we normally see the sodium ion concentration outside is more and potassium concentration is less, but inside just you can see the opposite fact, that is concentration of potassium is more and sodium ion is less. So generally once potassium ion concentration is more, this potassium ion can be gone out. Movement of potassium ion you can see it can be moved from inside towards outside. Actually the potassium ions will remain here in the cell with anions, normal anions. Now, if we talk about what are the different types of anions we have, that is phosphate, that is negatively charged, and proteins. Now, we are talking about how this negativity is maintained. Here, I have mentioned that the first channel which is functioning here is sodium potassium ATPase. With the involvement of this channel, only the development we can see is -5 millivolts. That is not sufficient. We cannot answer. Means we have to look for other channels. What is the other channel? That is the leaky potassium channel. The leaky potassium channel, always the tendency is to bring potassium ion out, and because of that, anion will remain inside the cell. That is the larger size. The phosphate ions or the proteins, they are larger in size, so that will be kept inside. Only potassium ion can go. Because of this movement, this voltage can be changed. That is -5 millivolt can be changed to -19 millivolt. Because of this behavior, the potassium ion is going out. The anions will be kept inside, and these anions they cannot leave the cell because that is the size of the particle, size of the anions are larger in size, cannot be moved out. So that is why this -5 millivolt will be again changed to -19. But our question is how the -70 millivolt is maintained. Then we will have to talk about another channel, that is leaky sodium channel, and it is a third type of channel we can see, that is the leaky sodium channel. In this we can see the movement of sodium ion. Sodium ions will be moved from outside to inside, because the outside of the cell we can see the larger concentration of sodium ion. Sodium ion will be more outside the cell, so the sodium ion will be moved from outside towards inside. So because of this this -90 millivolt will be changed to -70 millivolt. Have you understood? So this -70 millivolt is always maintained, and that we consider it as resting membrane potential. So during resting condition, this negative potential remains there, and this negativity has to be there. So three different channels we have mentioned. One is sodium potassium ATPase, and this capacity of this channel is only to bring potential from 0 millivolt to -5 millivolt. Now next is, I have mentioned the leaky potassium channel. This leaky potassium channel can bring the potential more negative, and that is -5 millivolt will be changed to -19 millivolt. But our aim is to talk about how -70 millivolt is mentioned. Then we have to talk about leaky sodium channel. Due to this, the sodium can be moved from outside to inside, and ultimately our -70 millivolt is maintained. We are talking about only sodium and potassium. We are not talking about other channels. Calcium channel is there, then chloride channel is there. Everything is there. But the main channel we are talking about, that is sodium potassium ATPase, potassium channel, and the leaky potassium channel, and the leaky sodium channel. Correct? Now here we can talk about the equilibrium potential of potassium ion, equilibrium potential of sodium ion. How much potassium will be moved out, how much sodium ion will come in, that can be calculated with the help of Nernst equation. That equation may not be important for you all. We must move to other topic, that is graded potential. This is the resting potential I have taught. Now come to the graded potential. Now graded potential, see, if we draw a diagram here, say this is the neuron, this is the neuron, this is the cell body, and we have the other neuron. In this, we are supposed to talk about this is the presynaptic neuron, and this is the postsynaptic neuron, and here this is the synaptic cleft. The gap between this is synaptic cleft. Now our topic is graded potential. Graded potential means, say it is the resting membrane potential, and that is resting membrane potential is minus 70 millivolts. If we stimulate this neuron, then what will happen? What we know is from the nerve ending there is a release of neurotransmitter, maybe excitatory or maybe inhibitory, and ultimately this neurotransmitter will bind with the receptor present in the post-synaptic membrane, and after binding this, maybe there will be an entry of sodium ion, or maybe there will be an exit of potassium ion, or entry of chloride ion. Ultimately, what will happen? This resting membrane potential may be changed to minus 55 millivolt, or this resting membrane potential may be reduced up to minus 90 millivolt. In this case, this is called depolarization. This is called depolarization, and here this is called hyperpolarization. This depolarization, what will happen in this depolarization? There is an entry of sodium ion. Entry of sodium ion, we are talking about depolarization. Or exit of potassium ion or entry of chloride ion, we are talking about hyperpolarization. Means the potential can be altered, maybe more positive or maybe more graphically. If we represent this, say this is the x-axis and this is the y-axis and this is the x-axis. So in this, if we talk about resting membrane potential, that is minus 70 millivolt. Resting membrane potential of the cell or resting membrane potential of the fiber is minus 70 millivolt. Now here the threshold potential is minus 55 millivolt. That is threshold potential, and this is minus 55 millivolt. Now we are talking about the development of potential that may be from minus 70 millivolt to minus 55 millivolt or minus 70 millivolt to minus 90 millivolt. Means this is the line we are talking about, minus 90 millivolt. So what will happen? This side, this is the time, millisecond, and this is the millivolt. Y-axis stands for millivolt and x-axis is millisecond. So what will happen? In this, there will be a change in the potential. Maybe like this, maybe like this, maybe like this. Or if it is inhibitory, then it may be like this, maybe like this, maybe like this. In these three graphs, it is excitatory. In these three graphs, all three are representing excitatory. Everywhere there is an entry of sodium ion. Everywhere there is an entry of sodium ion due to the involvement of leakage sodium channel. Sodium ion will enter into the cell. So the potential will be changed from minus 70 to minus 65, then minus 63, then minus 60 millivolt like this. So this is called EPSP. The full form of EPSP is excitatory post-synaptic potential. Excitatory post-synaptic potential, I must write it properly. Excitatory post-synaptic potential. Post-synaptic means, again you remember, this is we are talking about post-synapse, post-synaptic potential. Or if we talk about neuromuscular junction, then instead of neuron, we should have the structure of muscle. In that fiber, we are talking about post-muscular fiber, that is the post-synaptic fiber. In that fiber, we can see the potential changes, and that is excitatory. Minus 70 change to minus 55, going towards threshold potential, it is below threshold potential. It is going not up to threshold potential. It is just below the threshold potential. It is below, but it is also just below the threshold potential. So it will come back. It will come back. So all these three potentials, A, B, C, all these three potentials are termed as excitatory post-synaptic potential. Correct? Now here also we can have the potential change. If it is inhibitory, say it is GABA. GABA is always inhibitory. So in this case, there will be an entry of chloride ion or exit of potassium ion. Exit of potassium ion or entry of chloride ion. Who will do this? The neurotransmitter will bind with the specific receptor, and this specific receptor will carry potassium ion from outside towards inside. It will carry potassium ion from inside towards outside. So there will be an exit of potassium ion and or the entry of chloride ion. Chloride ion will be from outside towards inside, and that will be done by the receptor only, the chloride channel. So because of that, the potential will be towards more negative. So gradually again, if it is say capital A, capital B, capital C, these all are inhibitory. So this is called IPSP, inhibitory post-synaptic potential. These potentials, you can see, these are all graded potentials. Why? Coming to this graph, I have drawn the diagram of EPSP, drawn the diagram of IPSP. All these graded potentials depend upon how much neurotransmitters are secreted from the nerve ending. How much neurotransmitter and how much neurotransmitters can bind with the specific receptor. Then only there will be an entry or exit of chloride ions, or that depends upon the availability of particular specific neurotransmitter, and this specific neurotransmitter will bind with specific receptor, and then you will have the response. Now coming to the action potential. Here, action potential is potential. So here we have to have a diagram inside the neuron, and this is the nerve ending. So this graph, this is the axon block, this is the axon block. Right? And here we have the availability of sodium ion. Availability of sodium ion. Positive ions will be there. Because of why positive ions will be there? Because the neurotransmitters will bind with the specific receptor, and this specific receptor will help bringing sodium ion from outside towards inside. Now what is happening here? Here, if we draw a diagram of the sodium channel. Okay, this is the sodium channel. This is the sodium channel. This is also sodium channel. This is also sodium channel. This is also sodium channel. Now there is another one is here you must draw the calcium channel. So this is the calcium channel. This is sodium channel. And here you must draw the diagram of potassium channel. Here it is potassium channel. Now there are three types of channels if we talk about sodium channel, potassium channel. One is leaky channel, another is voltage gated channel, and the third last one is ligand gated channel. Correct? This channel is voltage gated channel. Meaning of voltage gated channel means this channel will be functioning as soon as there is a change with the specific voltage. Means we are talking about threshold potential. We are talking about threshold potential. What is threshold potential? It is that minimum potential where we will have response. Response means this voltage gated channel will be functioning. Correct? Now, as soon as there will be an entry of sodium ion, this minus 70 will be changed to minus 55 millivolt. So what will happen? This positive charge will be moved towards negative charge towards this channel, because these are all negative. These are all negative. This is minus 70, minus 70. Everywhere this is negative. So this positive will be moved towards this. So here also we can see the minus 55 millivolt. Once it is minus 55 millivolt, then there will be an entry of sodium ion. Correct? Now again here it is plus 30 millivolt or plus 40 millivolt. Once it is plus 30 millivolt or plus 40 millivolt, then again this sodium channel will be functioning, will be activated, then there will be an entry of sodium. Once it is plus 30 millivolt or plus 40 millivolt, then again this sodium channel also will be activated. So voltage rated sodium channel will be activated. So there will be an entry of sodium. Ultimately, this positive ions voltage becomes plus 30 millivolt. Why I am talking about plus 30 or plus 40? There are textbooks where you can see this variation. Ultimately, the plus 30 millivolt will activate this calcium channel, and there will be an entry of calcium. That is voltage gated calcium channel, and this voltage gated calcium channel will be active. What will do this? Here we will have the vesicles, and this vesicles is filled with the neurotransmitter. Now these vesicles will have a particular protein here in the membrane, and here also we will have the protein in the presynaptic membrane. So there will be an attraction. Means this vesicle will be moved towards this. So if it is moved towards this, then we can talk about this type of diagram. Vesicle is moved here, and once there is a binding between vesicle and the presynaptic membrane, so whatever the material is will be released here in the synaptic cleft. This is the synaptic cleft. So the neurotransmitters will be moved in the synaptic cleft. Now rest of the things, it will be empty vessels. Now here we will have this calcium channel I have drawn here. So another calcium channel we must draw here. Now here the potassium channel, what will happen in the potassium channel? Now if you look at this voltage, this will, as soon as this will be plus, we may start from this, the voltage becomes plus 30 millivolt or plus 40 millivolt. So what will happen here? The sodium channel will be closed and the potassium channel will be open. The potassium channel will be open. What I have said, once the voltage becomes plus 30 millivolt or the plus 40 millivolt, sodium channel will be closed and the potassium channel will be open. So there will be an exit of potassium ion. So once the exit of potassium ion, this voltage becomes minus, the voltage becomes minus 70 millivolt. Now again the same situation will happen with this also. Once if this becomes, the voltage becomes plus 30 millivolt or plus 40 millivolt, this will not be functioning. There will be an exit of potassium ion because there is a stimulation of voltage gated potassium channel. So the potassium ion will go out. Because of this, again this will be minus 70 millivolt. Once it is this minus, so once it is a negative millivolt is created here, this calcium channel will not be functioning. The calcium ion will not be entering. The calcium ion will not enter here. The calcium channel will be blocked. Will not be functioning. So what is happening? The action potential, once it is generated, it is moved. If you again talk about the type of conduction, yes, type of conduction, then there is a term saltatory conduction. Saltatory conduction, that is the first conduction system, saltatory conduction. Because if we talk about the neurone, we have nerve here, we have here myelin sheath. Here it is the myelin sheath, here it is the myelin sheath, here it is the myelin sheath. Myelin sheath is there, this is the myelin sheath, and here we have the membrane of the neuron, and this is the nerve ending, correct? Up to this we have. Now this is the node of Ranvier here. Don't see which one? This is node of Ranvier. Now because of this myelin sheath, what I am saying here, we do not have sodium channel here. We do not have sodium channel here. Only sodium channel is available in this region. Sodium channel, potassium channel is available in the node of Ranvier. Correct? So in this we have sodium channel. Here we have sodium channel. So there is jumping. There is jumping. If we again look at the type of neuron, one is myelinated, another is non-myelinated. So myelinated neuron, conduction in myelinated neuron is fast conduction, because the myelin sheath is there. In this myelin sheath there is no sodium channel. Only sodium channel is available in the node of Ranvier region. So there is a jumping of the ions from one node to another node. So that is why the conduction becomes fast. But the neuron where there is no myelination means there is no myelin sheath, means everywhere there is sodium channel, everywhere there is a potassium channel. So the conduction is slow because everywhere there is a sodium channel. There is no jumping. The sodium channel, all membranes, every area of the membrane will have sodium channel as well as the potassium channel. So there is no jumping. Slowly there is depolarization as well as repolarization. Again I am using here the new term, that is repolarization. Here the plus 30 millivolt or plus 40 millivolt is converted to minus 70 millivolt again, and that is called repolarization. Again, the polarity of the cell is changed towards resting condition. So that is why this is called repolarization. Correct? Now if you represent all these graphs graphically, resting membrane potential, then gradient potential, and then action potential. If we put it graphically, then again you draw the x-axis and the y-axis. Now coming to the minus 70 millivolt, this is millivolt, and here this is, say it is minus 90 millivolt. So here it is threshold potential, say it is minus 55 millivolt or minus 60 millivolt, you can say this. So what will happen? If it is the EPSP, then the graph is like this. Once this becomes threshold, then we will have the action potential, and that is plus 40 millivolt. I must use this value, plus 40 millivolt. So whole thing, if we talk about, this is EPSP, this is EPSP, this is EPSP, and this is depolarization. This is depolarization. Voltage minus 70 millivolt is changed to plus 40 millivolt. And again this is repolarization. And this is positive after hyperpolarization. Positive after hyperpolarization. So what we can see here, the IPS, if we draw the IPS, so this is the IPS. This is IPS. So in this graph, what we can say again, that all EPSP are not converted to generation of action potential. We can have action potential provided the potential should come to threshold potential. We call it threshold potential. If it comes to this level, then we can expect there is a stimulation of voltage gated sodium channel. Correct? Voltage gated sodium channel. And then the capacity of this channel is to bring the potential up to plus 40 millivolt. Why the capacity I am talking about? Because as soon as this becomes plus 40 millivolt, sodium channel will be closed. Correct? Sodium channel will be closed. There will be opening of potassium channel. So this, as soon as there is an opening of potassium channel, then the potassium ion will be moved out. Will be moved out. The potential will be changed to plus 40 millivolt to minus 70, means it becomes minus 80 millivolt also, because the activity of the channel is made such a way that it will cross minus 70. Cross minus 70, it may be minus 80 or it may be minus 85 or it may be minus 90 millivolt. And then there is an involvement of sodium potassium ATPase channel, and ultimately the potential will be brought at resting level, and that is minus 70. This action potential we can see in muscle as well as in neuro. This type of action potential, these are the phases. This is depolarization, this is depolarization, and this is positive after hydropolarization. Once this action potential is developed, then this action potential is moved. Correct? EPSP is not moved. IPSP is not moved. Which is moved? Action potential is moved. Action potential, if you generate at any point in your body, this action, if there is generation of action potential, this action potential will be moved from periphery towards center or from center towards head. Correct? So this way our conduction is taking place. I have told you about the different type of conduction also. The special first conduction you can see in the myelinated neuron, that is the saltatory conduction. How the nerve impulse means action potential is moved from one place to another place. Once it is generated, it will move. EPSP is not moved. Only action potential is moved. If action potential is moved, we will have response. If it is not moved, there will be no response. Response means, already I have told you, that is the nerve ending. Response means there will be release of neurotransmitters, and it will bind with specific receptors, maybe in the muscle fiber, specific receptors, and there will be an entry of sodium ion, or there will be an entry of chloride ion, or there will be an entry of. Correct? Now, this is the story of skeletal muscle, or this is the story of neuron. What will happen in the cardiac muscle? Cardiac muscle. The cardiac muscles. If we look at the action potential recorded in cardiac muscles, action potential in cardiac muscle already I have delivered this. Now see it again. If we draw the diagram of action potential recorded in cardiac muscle, then it is like this. Different phases are. This is the plus 40 millivolt. This is minus 90 millivolt, and this side it is millisecond. Here it is 100, 200, and 300 millisecond. It is millisecond. Correct? It is millisecond. So phases, if we talk about, this is depolarization. This is plateau phase, and this is depolarization, and this is positive after hyperpolarization. Okay. Now coming to the minus 90 millivolt, what is the threshold potential here? Maybe minus 70 millivolt or minus 60 millivolt. So we must concentrate with only one data, that is minus 60 millivolt. That is the threshold potential. Correct? Now here one extra case you can see here is, correct? This is the cardiac muscle. Cardiac muscle means, if we talk about cardiac muscle, this is atrial muscle, and another name is ventricular muscle. Muscle present in the ventricle, muscle present in the atria. So this is the atria. This is the right atrium, this is left atrium, this is right ventricle, and this is the left ventricle. So we are talking about this. If we bring another tissue here, that is SA node, then this is the AV node, this is internodal pathways, and then we have right bundle of his HIS capital H, bundle of his right bundle, and this is the left bundle, that is also bundle of his, and this is the Purkinje. This is the specialized conducting tissues of the heart. In specialized conducting tissues of the heart, the resting membrane potential is minus 60 millivol. Correct? First, I tell you why there is a peculiarity. Because if we look at the histology of cardiac muscle, in the cardiac muscle, if we look at the histology of the fiber, or the if we talk about the amount of calcium ion present in the cardiac muscle, we do not have adequate, cardiac muscle do not have adequate amount of calcium ion. This fiber needs calcium ion from extracellular space. So what is happening here, in this space there is an entry of calcium ion as well as exit of potassium ion. Because this is the point where repolarization starts. Now here there is a competition between calcium ion and the potassium ion. So here, if the entry of calcium ion is more than the potassium ion, then this type of nature we can see. Constant positivity. Nature means constant positivity we can see with the fibers. Why constant positivity? Positive charge, cell remains positively charged because there will be an entry of calcium ion, and calcium ion will be more, entry will be more than the exit of potassium. And then after that there will be an exit of potassium ion. Potassium ion will be more than the calcium ion. So it will again come back to resting condition. Minus 90 can be changed to minus 100 or minus 10, and then slowly it will come back to normal condition. Here the minus 60 millivolt means we are talking about the resting membrane potential of specialized conducting tissues of the heart. Please, attention please. We are not talking about the resting membrane potential minus 70 millivolt or minus 90 millivolt. If it is minus 70 millivolts or minus 90 millivolt, we have to stimulate to bring the potential up to TP, threshold potential. है ना? जब threshold potential आ जाता है, automatic voltage rated sodium channel will be activated. But in this case, the resting membrane potential is minus 60 millivolt. Means, do you need any external stimulation? No. Do you need any external stimulation? No. Because the resting membrane potential is already minus 60 millivolt. So what will happen? Automatically, voltage gated sodium channel will fire, or the voltage gated calcium channel will fire automatically, or the both sodium ion and calcium channel both will fire. This fiber does not need any external stimulus. So that is why we call it specialized conducting tissues of the heart. Is specialized. Specialized means the resting membrane potential is minus 60 millivolt or less than minus 60 millivolt. We don't have to stimulate. This will fire automatically. There will be a depolarization followed by repolarization. Depolarization followed by repolarization. We don't have to stimulate externally. Till death means if this become stops, we will die. Correct? Yes.